Okay, good morning to the Westmoreland COVID call. We are recording this webinar for future use and reposting. Feel free to ask questions in the question box. We will get back to your questions after the webinar ends. I'm also going to be opening up Sarah Stenger's microphone at this moment. So Sarah, you should be. Hey, your microphone should be open, Sarah. So welcome to the call.
Hi, yes, good morning. There was a bunch of pop-ups wanted to know if I wanted to be viewed. Yes, hi. Our office had forwarded over the latest grid, but I saw that when I looked at it last night, I saw that Tony had not updated some of the areas. We had the first area I'll touch on is 302. Looking at the October data, it's actually, we had 81 in October of this year. And when I looked, it was 89 of last year. So those are actually down a little bit. We have some new data that I thought was interesting that I wanted to report on. Beacon has started to look at percentages of telehealth options that were reported during this period. And it started out in February, only 8% of outpatient mental health therapy services were telehealth, and that number had rose to 62% in April, and then in May, 63%, and that number has actually started to decline. As of August, it is down to 48%, and they are going to continue to track that level of care. But that is across all outpatient mental health services. With looking at the initial reportings of those, most people are very happy with doing telehealth, so we're interested to see how this is going to continue out. Let's see here. Our office has also started to plan for continued trainings during this time period. We're looking at telehealth trainings for more housing options, more LGBTQ options, and we're in our initial stages of planning for the CIT crisis intervention team training for the police and first responders. So we're gonna try to get that going for in the spring or early summer here to try to continue to do some outreach. We are missing a lot of provider data moving along for September and October. I'll try to have a lot of that caught up for the next meeting. We have with the MA enrollments, we had in October of this year, we had 66,383 compared to the same time period of last year where there was 59,161. So we still continue to see monthly increases on those numbers. Let's see what other updates were there. We're still offering numerous support groups through Mental Health America. I believe that information was put out in the past, but if anybody's interested, please just let me know and I can re-forward those out again. There's different options, different times, some during the day, some at night. Another on the grid, another information that was updated was Feeding the Spirit. They had requested more than doubled for requests for community help and support. Last year at this time, there was 457 requests for assistance, and this last month there was 1,087. So that is more than doubled. Another area where we are continuing to see changes with our support internally with mental health services, due to the eviction memorandum, our numbers for assistance for this category are very low right now, but we're waiting to see what happens in December to see if things change, because I'm sure that number will go up once that memorandum is lifted. Let me see, what else do we have? For those looking for services for mental health consumers, we have several placement beds available right now with our CRR level of care and supportive housing beds. that continues, we can assist with that. Let me see. What else was there? I am new to this, trying to fill Dirk's shoes, but if anyone is looking for any other data or information that we can start to track, please just let me know and we'll try to work with that. If anybody doesn't have questions, I think that is a lot of the information that I did have information on.
That's really helpful, Sarah. Thanks. For those of you who are who have just joined the call, Sarah is the interim administrator for Westmoreland County Behavioral Health and Developmental Services. As you all know, typically this call is hosted by Dirk and Alyssa and myself. I was really appreciative that Sarah could jump in and provide some of that data that Dirk had provided to us previously. So thank you for your report, Sarah. Again, this is the Westmoreland County call for the COVID-19 response, specifically for those in our human services sector and our nonprofit sector. We have a great group of folks that are joining us besides Sarah today. Alyssa will give a report from the United Way. We're honored to have Commissioner Doug Chu with us as well, who will talk to us from the county's perspective, specifically about the CARES funding. Dr. Fox is with us, as well as Bud Mertz from Public Safety. We've got Dr. Conway, Deb Thapara, Jennifer Miller, Jordan Polito to talk about the Human Services Study, and finally Mandy Zalek from Westmoreland Community Action. So really glad everyone was able to join us. During Sarah's report, I'm sure you all were looking at this amazing piece of artwork that was provided to us by the Westmoreland Museum of American Art, which is entitled Game, Turkey and Rabbit by George Hetzel, which depicts a kitchen scene with a cat caught attempting to ruin the day's spoils by stealing the rabbit. In 1855, Hetzel exhibited at an annual exhibition held at the Pennsylvania Academy of Fine Arts in Philadelphia and submitted 3 still life works, this being one of them. I just wanted to make sure you knew that, because I'm sure you were curious about that cat stealing the spoils of the day. We're just going to go ahead and keep moving forward with our reports, if that's okay with everyone. I'm going to go ahead and pass it over to Alyssa Chodowski to give us the United Way report.
Thanks, Bill, and good morning, everybody. Just a couple things from United Way. 211 data still, as Sarah was mentioning, we're still seeing a lot more calls this year compared to last year. In just this last month period of October and through this time period of November, we've seen our calls about 1,300 calls, almost all. About 40% are for rental assistance. So as indicated, a lot of people, I think, are seeing any savings that they did have no longer with them, and struggling to be able to pay their rent. Food as well, up a little bit, mostly people calling for the food pantry addresses and information. And then we're seeing a lot of requests too for some utility support, mostly with utilities. So again, the best way to do that is to call 211. You can connect people with whatever resources they would need to help them through those difficulties. And really, it's the best resource. We keep it up to date for people in Westmoreland and throughout southwestern Pennsylvania. A couple other things I wanted to mention. We did, from the United Way, postpone our community impact grant applications. Generally, we've put out a request for proposal on November 1st each year. This year would be our United for Families impact area, which formerly was income and financial stability. With our agencies and individuals continuing to struggle, we decided to postpone this, not to put any more items on people's plates that are already overflowing. This group is our shelters, the food bank, and other agencies that we support with emergency basic needs. We just felt it would be better to postpone that. So we'll make an announcement in January of 2021 how we will move forward with this grant in particular. But if you're a United Way partner agency receiving funds, everything is as usual. So just keep doing all the good work that you're doing, and know that we appreciate that. Any questions, please feel free to contact me or Jesse Spar. The last thing I wanted to mention was that the cold weather shelters will be opened. They generally open starting November 1st when evenings get below 25 degrees. We haven't had that luckily yet, but we know the winter is coming. And as in the past, we're cooperating with Union Mission and Welcome Home Shelter, Feeding the Spirit, Westmoreland Community Action, all great partners helping us with this. So individuals who find themselves in an unsafe place in the evening or without heat, call 211 and they can connect them to the shelter. We also have transportation available. So if transportation is an issue to get to the shelter, we're able to handle that as well. So we'll be following all CDC guidelines on that, taking temperatures, asking questions and such. So just wanted to make sure people know that that resource is available this year and appreciate cooperating with the shelters. Thank you. That's what I have, Phil.
Thanks, Alyssa. I appreciate that. From the Community Foundation of Westmoreland County's perspective, I just wanted to take a moment to thank everyone who applied for our Healthy Communities grant cycle. These are grants to support the most vulnerable populations in our community. We received an overwhelming number of applications totaling somewhere in the ballpark of $700,000. We have about 300,000 to distribute. The grants committee will be meeting this next week, at the beginning of next week, to make those decisions, and we'll announce those grants probably end of next week. So please keep an eye out if you're one of those folks that had applied for those grants, and I appreciate your thoughtfulness. That's all I have from the Community Foundation of Westmoreland County's perspective. I want to pass this over now to Commissioner Doug Chu, who's joined us to give us a little bit of a report on the CARES funding and anything else he feels pertinent from the county's perspective. Commissioner?
Good morning, everyone, and thanks, Phil, for inviting me on today. I don't think I was on since summer had just began, so it's good to see that this has continued. The first thing I'll comment on is I just heard a lot about evictions. The county does have a lot of funds being administered by Union Mission and Dan Carney's group for evictions, and the Westmoreland County Housing Authority. So both groups are administering funds, block grant funds for evictions. I don't remember the exact value, but we just got another large chunk that will go to Dan and Jason Bergoni to work on evictions. I guess the election is still going on, if you haven't noticed, in Westmoreland County. So we're still counting ballots, so nothing is official yet. And then with CARES funding, we distributed almost 400 and some grants to small businesses and to nonprofits. We are planning a second round. And in the second round, we are making some adjustments that will allow some additional businesses to come on board. If you're a nonprofit, those agreements and checks just started going out in the last week or so. And so you should have that agreement and money within, I think, definitely within November, provided the agreements get signed fast enough between both groups. The state has approximately $1.3 billion that they have not yet spent. And in the law that provided for the county share of CARES money, any money left on December 1st would get distributed to the 60 counties to spend out by December 30th. So we'll be on a very, very tight timeline. The second round of applications will not have an end date, nor will it have a total dollar value for either business or nonprofit groups, because at this time, we really aren't sure how much money will come in December. $1.3 billion equally distributed to 60 counties is about $23.7 million for Westmoreland. And if you were to distribute it using a population-based formula, as was done in June, then you could predict we might end up with an allotment similar to what we got in July, almost $30 to $32 million. We do have some ideas on how to push that money out quickly. We have an excellent healthcare system here that I know myself and my colleague Sean Curtis would like to help additionally because we want Excella Health to stay in this area and make sure that everybody in Westmoreland County has access to high quality, highly rated health care. I plan on talking to Director Mertz, who's also on the call today. We are seeing very large rises in COVID cases currently in Westmoreland County. I don't think that's new news for anybody here. And I would love to see if we could maybe do some additional types of testing for people that are homebound and can't get out. Some mobile testing, or to continue the testing site that I'm sure Director Mertz is going to talk about whenever it's his turn. So that's basically where we are with CARES funding. We have not yet spent the original $31.5 million that we have. We are working to earmark funds for different projects within Westmoreland County. I know Director Mertz has a lot of his equipment sitting outside because PPE is in the buildings that used to house the equipment. And so we're working to try to spend some of that money to make sure that we're covered for this pandemic going forward. The applications for round 2 should hit in the next few days. My office is always available if anybody wants help filling them out. And we are trying to do a much larger drive and push to market this to as many businesses and nonprofits as possible. The turnout for nonprofits was only about 125 applicants. And so hopefully we can get a few more applicants in this round. And that's all I have, Phil.
Great, thank you so much, Commissioner. I appreciate it. I know that there are questions that folks are shooting over to us now for you, but to stick with our normal scope of procedure, what I'll do is I'll forward those to you later, Commissioner, if you don't mind, providing some of those answers, and then we'll email those out to the group just so everyone has the same answers and to just to be in consideration of our time and our process. Are you comfortable with that, Commissioner?
Yeah, that's fine with me. We have an election board meeting this morning, but my afternoon could be spent answering whatever questions your group has, Phil.
I really appreciate that, Commissioner. I'll make sure I'll get those to you as soon as possible.
Okay.
Thanks for joining.
Thank you.
I'm going to move on over to Dr. Fox from Excella. I appreciate you joining us, Dr. Fox. I know you have a lot on your plate this morning. I'd love an update.
Good morning, everyone. As you've heard from others, the numbers in the county are certainly larger. We have 56 positive patients across our 3 hospitals, so that's a significantly larger number than I've reported in the past. We have 8 of those patients utilizing, or 8 total patients, I should say, utilizing ventilators, only 4 COVID related. And we are seeing a much lower utilization of ventilatory support for these patients, which really is good news. And of course, we continue to have ample ventilators available for us. But to give you all some perspective, when we look at the cases, 55% of the total positive cases have occurred since October 1st. 62% of our total hospitalizations have occurred since that time. And unfortunately, 68% of the total mortalities have also occurred since October 1st. So a lot going on this fall. When we look at the patients that we're seeing, 84% are 65 years of age or older. So it does seem to be, and those are of our hospitalized patients, but it does, for our most ill individuals, it seems to be impacting the elderly population most specifically, and of course, those with underlying medical conditions. Excella has been working very closely with our colleagues at the Allegheny Health Network and from UPMC to help support the skilled nursing facilities and the personal care homes in Westmoreland County. There are about 60 of them, and we've been working to provide them with assistance in terms of getting their residents and their staff tested as is required by the Department of Health. We're providing fit testing. emergency PPE. We've worked with Director Mertz to get some additional help with that. So when they need PPE, when they have staffing issues, and when they have outbreaks, we have staff who actually go into the facility, staff from our infection prevention and control group who go in to provide education and really give them assistance in identifying how best to care for the patients that they have. So I would say this, my message for those who are on the phone and on this call, masks are really important. Please, please, please continue to wear masks when you are around other people. And I would be very diligent about this. And, you know, even if you're in your office, you need to close your door in order to take your mask off. Please maintain social distancing. Hand hygiene remains important. Another area that we have seen issues with, exposures seem to occur when people are eating with others. And of course, you know, by nature, you have to remove your mask. So, you know, if you have individuals that you're working with, they really need to be separated, you know, beyond that 6 feet whenever they are eating. Individuals can transmit the virus 48 hours prior to the development of any symptoms. And when we look at, you know, what that transmissibility is, we're really looking at individuals who are within 6 feet for 15 minutes, and that's a cumulative 15 minutes over a 24-hour period without masks. So, you know, it's important that anybody who has symptoms should isolate. They should attempt to get tested. I think Director Mertz will tell you that there was a Lower Borough testing center that was stood up by the Department of Health and others that was in effect for about a week. That's no longer up and running. Fry Farm Road does continue to be up and running. It does require an appointment. 1-800-727-9558 is that number, but we can arrange to have you tested. But if an individual does have symptoms, you should be thinking about folks that you may have been in contact with 48 hours prior to you developing an illness. And, you know, it's probably a good idea to start writing down that contact list so that you can cooperate with the contact tracers when they call. One of the things that the state has told us is that the degree of cooperation with contact tracing is not what they would like for it to be. And when we don't have that cooperation, we can't notify others. And when we can't notify others, we can't stem the spread. So it's really important that people are, you know, compiling a list of their contacts, and absolutely please cooperate with those tracers. If you are positive, you must isolate for 10 days. You can come out of isolation if you're fever-free for 24 hours. That's very important. And if you're a contact of someone, you really need to quarantine for 14 days. They do recommend that you get tested on day 2 or 3, but getting a negative test is not a get out of jail free card, because you still can develop symptoms and illness anytime within that 14 days, but it can help to inform future spread. And if you are a household contact of somebody who is COVID-19 positive and you can't separate yourself from them, in that instance, you need to remain quarantined during their 10 days of isolation, plus an additional 14 days. So, you know, again, those things are really important. I know it's tough for people. They don't really want to remain at home, but we really need to encourage people to do it. So don't let your guard down. You know, I know we're coming into Thanksgiving, and I know people want to spend time with their family. It's really, now's the time to think about virtual visits with their family and their friends. And that's it for us. And if you have questions that Phil forwards, we'll be happy to get them answered.
Really appreciate it. Thank you, Dr. Fox. I appreciate your time. I know it's a stressful time. I'm going to move on over to Bud Mertz with Public Safety. Bud.
Good morning, and thank you. I truly enjoy this format that we have here, and as it continues to go, because personally, I think the partnerships are the best, or the only way that we as a community is going to get through this. We've between partnerships and collaboration, we've you know, is our best handle on it. I can't say enough as far as the relationship that the Department of Public Safety has with Excella Health. Our days start at 6:30 in the morning now with phone calls between Public Safety and Excella Health, just talking about the current snapshot that we have, what they have, what we see, and back and forth. With the support of the commissioners, as Dr. Fox mentioned, we were able to purchase PPE to provide that interim infectious control equipment, so to speak, to allow before the RICP program steps in, as Excella responds to a hot skilled nursing or personal care home. At least we have that PPE equipment in there until the RICP equipment shows up. So again, it's all about partnership. I can't say enough about the communications we have with the intermediate unit and Dr. Conway. And I really want to stress that going forward. We haven't changed our tactics. I'm not going to go through all that, but we continue to keep a close eye on everything that we possibly can. And the important part, though, is that we turn around and we share that information and build up the partnership in the community, such as this format here. We did host a 5-day testing site up in Lower Borough. This was part of the Department of Health's use of the CARE Acts, where they covered the cost for that. We used a local emergency management coordinator to be on grounds to help them find a site and set it up. They came in with the expectation that they were going to do about 100 tests a day. And I know that on Tuesday they did 210 tests. So every day, I didn't have yesterday's report yet, but every day the test numbers exceeded the expectations of that. I do know that the Pennsylvania National Guard has responded to the Quality Life Services home up in Apollo. It's in Washington Township, and they're providing technical assistance to that facility as it goes forward. I have to say my biggest concern is, what's going to happen when the CARES Act monies run out and a lot of these programs go down. There's a news release that came out today that from the governor to the president encouraging the Title 32 to continue the work of the Guard. Our National Guard unit is they are military people, but they have to have that permission from the president to cross lines into that civil work, and so that's very important for us to follow, because the National Guard did a wonderful job at the Manor, and they continue to service these type of facilities as well. I have concerns about to follow up on the CARES Act, a second funding source that's going to allow great programs such as the RICP program that we've been talking about, and the great work that Excella Health is doing with the skilled nursing and personal care home. If that runs out by the end of the year, or what's going to happen there, because we're in the height of it. So the best I can continue to say is partnerships, and we're out here to help coordinate any of those partnerships possible to need. But we as a community, this is a strong format, and we as a community is going to get through this. I feel confident in that.
Thank you, Bud. I appreciate that. I agree with you. Partnerships are key. Let's move on over to Dr. Conway to talk to us a little bit about our schools. Dr. Conway.
Right. Good morning, and thank you again for the opportunity to share. I'll be brief. It looks as though that we will have at least 15 out of the 17 public school districts will be open for some type of in-person instruction on Monday. It could be 16 out of 17 or 17 out of 17, depending on board meetings that are occurring this evening for that. We are also anticipating the numbers coming out tomorrow to determine whether we are going to continue in moderate or go back into the substantial area. As you may be aware, the Department of Health and the Department of Education recommends that schools go into a remote virtual setting in a full-time manner once a county is within substantial for at least 2 weeks or greater. They recommend that you wait until you have 2 consecutive weeks of a designation before changing model. So since we've only been in 1 week of moderate, the data that's coming out on Friday is pretty important to determine whether we continue in moderate or if we're going to continue if we're back in substantial. So that's one thing I just wanted to share with you. Also, the intermediate unit has served as a distribution center for masks. The federal government sent millions of masks to the state of Pennsylvania, to the PDE. The PDE then has utilized the intermediate unit system to disperse those masks to not only public schools, but also non-public schools. Right now, only child masks have been distributed. We are waiting on the youth adult sizes to come in, which we anticipate any day now. But those are the 2 items I wanted to share with the group today. Again, thank you for the opportunity.
Thank you so much. Hopefully we can keep those kids safe getting back to school in person. Let's move over to Deb Thakrow with Feeding the Spirit. Deb, do you have a report for us today?
Yes, I do. Thank you for inviting us again. These are such informative meetings, and to echo everybody, our partnerships are vital at this time, as always. In October, as we spoke last time, we moved our meal distribution from St. Clair Park back to Otterbein Methodist Church on Thursday nights as takeout and drive-through only, of course. We were a little concerned that this might put the numbers down due to scheduling and people not being able to attend. But actually the numbers have been up that we've been distributing. So in the last 6 weeks, we have distributed 1,329 meals as takeout or drive-through. And the average is 225 meals per week. When we were doing our sit-down meals, we were averaging about 100 a week because that's all we could fit into the fellowship hall. So we're quite pleased that we're reaching more people that are in need with the food distribution. We're sad we can't gather, obviously, as a fellowship in the community, but we also are seeing new people come, people that are in need because of unemployment running out, or people in need because lost jobs, lost wages, or having to quarantine for 14 days because of a positive test, so they miss work and their wages aren't covered. You know, all of these things that none of us were planning on. So we are very grateful that we can distribute this way. The other thing, as Sarah mentioned, is we really are seeing an increase in the calls for rent assistance and homeless placement. In September, we took 57 crisis calls for rent assistance. In October, we took 84 calls. That's a huge jump, and you know, we're just going into fall and into winter, and so we are certainly very mindful that we're probably only going to have those numbers increase. The same thing for the homeless placement. So we thank everybody who partners with us, and we know that we are all going to do our best to help all those in need. But I just really want to express our gratitude to you all for helping us continue to do this well. That's all I have.
Thank you, Deb. I know you have another meeting to run to, but I appreciate you taking the time out to join us for a little bit this morning. Moving on to Jennifer Miller with the Food Bank. Jennifer.
Thanks, Phil. And thanks to Deb and all the other nonprofit organizations throughout our county that are doing the work that we're doing. It's so imperative right now, and partnerships and collaborations are truly the key. If it wasn't for our collaborations throughout the county with all of our food pantries and agencies, I can't even imagine how we would be doing it. The food bank is doing well, better than we were at this time last month. We unfortunately had an outbreak here at the food bank, and we had 7 staff who had the virus, and the rest of us, 17 of us, did not. We all were tested for obvious reasons because we are an essential service. We needed to remain open to get our food out. We did have to move some of our pantries up a week as we were losing drivers, and we needed to make sure that the food got out for the month of October. Thank goodness we didn't lose any more, and we were able to get done what we needed to get done. The staff ourselves packed a lot of boxes on our own because we couldn't have volunteers in the building. So we made sure that all of the November senior boxes were packed, and all the rest of November regular food pantry boxes were packed as well, and moved into December. So at this point, our high water mark still remains around 9,500 people, and we saw that at our peak, which was around April and May. We are starting to see the numbers climb up a bit, not anything too substantial. There's still a lot of services out there that are providing food on a regular basis, so we're not getting hit as hard as what we thought we were going to be getting hit. But that still remains to be seen for November and December, when we usually see the numbers jump anyway. So, you know, we were able to get turkeys in for Thanksgiving. So anybody who receives services from us through the month of November will receive a turkey. And also during the month of December, they'll receive hams. So we're very, very happy. And that is because of the generosity of the community and foundations throughout the area that we're able to do that. If it wasn't for that funding and, you know, through the United Way as well, we wouldn't be doing what we're doing. So we're very, very grateful for that support. Overall, you know, things are going well. The senior numbers for our commodity supplemental food program are rising as well, more so than what they have in the past. So we are seeing the senior need accelerate a bit. So, and other than that, I think, you know, things are moving right along. Collaborations are still continuing with other human service organizations. And we're very grateful for that. So thank you so much.
Awesome. Thank you, Jennifer. I appreciate it. I'm going to pass it now over to Jordan, who's here with the Hill Group, who will talk a little bit about the human services study that Hill Group's been working on in partnership led by United Way. Go for it, Jordan.
Good morning, everybody. Thanks for having me again. Just a quick update on where we are in this process. Many of you know this because you are currently in the process of completing our human service assessment survey. Thanks to those who have, thanks to those who are in the middle of it right now. As a quick reminder, particularly for those who may be new to this call, we are, as Phil said, in the middle of an assessment of human services in Westmoreland County, really looking at the ecosystem overall and trying to determine how it could be improved, recognizing that it's pretty strong already. Tons of great providers providing high quality services in all corners of the county, but how could it be better? In what ways could we invest in the ecosystem, enhance the ecosystem so that high quality services make their way to every person who needs them when they need them? So to that end, the survey that I mentioned is out there and is live now. If you or your organization has not received an invitation to the survey, or if you would like to participate in the survey, Allison is posting in the chat box now, or shortly after our call, a quick link just to give me your name and email address, and I can make sure that survey makes its way to you. The other thing that we're doing is benchmarking, looking at other places around the country that are like Westmoreland County in many ways to determine if there are practices in human service delivery that we can borrow. And I'm pleased to tell you that it looks like there are some places around the country where we could learn a few things. I'm also pleased to tell you that it appears that we could teach those places a few things. There are some great things happening here, but I think that we'll learn some things from other places too. So all that to say, we're in the middle of this process. The survey, interviews, conversations, and the benchmarking are what we are involved with right now. And over the next couple of months, we're going to pull together some recommendations that we think will be actionable to improve this human services ecosystem. And finally, in addition to the survey, I invite anybody who's hearing this right now, if you've got something to say or an opinion or a question or a concern or an idea about how to enhance human services in Westmoreland County, give me a call or an email. Happy to sit down and chat. Thanks.
Awesome. Thank you, Jordan. Once again, I want to point folks over to the chat function of the webinar. If you look at the chat function, you'll see that Allison has posted a hyperlink there. If you click on that, it does take you to the Hill Group's site, where you can just have to enter in your name and your email address, and that will give Jordan the ability to make sure that you receive the survey to fill out. Again, we're only as strong as the data we have, and so we need to make sure that as many organizations as possible are filling out that data. It may take a little time, but I can't stress again how important it is so that we have a really clear picture moving forward, so that we can make our human services sector the strongest it can be. So thank you, Jordan. Appreciate that. We're going to finish out our call today by moving over to Mandy Zalik with Westmoreland Community Action. Mandy.
Great. Thank you all for having me here to give an update of what's been happening at Westmoreland Community Action and things that we have going on in the community. I wanted to first highlight that we still maintain our crisis hotline. That's something we've had for years. So our mental health crisis hotline and our mobile responsive team have been super busy and doing amazing work in the community throughout this whole COVID process. And they respond to any mental health crisis, and also the mobile team can assist with responding to situations if police are called and the individual does have a mental health issue. They can assist in those de-escalation processes as well. So if there is a crisis need, I urge you to share that information with anybody that we're working with, friends and family. It's 1-800-836-6010, and the crisis hotline is 24/7. So there's always somebody there to answer the phone and be a lifeline for individuals that are in mental health crisis. With our mental health side, we still have some mental health housing options available. You can always call into our main office and we can connect you with the mental health team if you have an individual who may need referred to that type of placement. We have a few different options. So placement depends on the individual's criteria and what they're presenting with and how independent they are. Feel free to reach out to us at the office for that. Our Head Start programs are also still taking referrals. We have 25 different classrooms throughout the county. So I know that's been a struggle with some families, is finding a balance with that. We have been following the school models with the school districts, if we're in session, if we're virtual. So we've been doing a lot of that. Our staff have been amazing at doing the cleaning and monitoring everything. Head Start and pre-K are ages 3 to 5. So we do have a number of spaces available. Again, feel free to call our office and we can connect folks directly to the Head Start team for referrals. Our main office number is 724-834-1260. And the intake person answering the phone can connect you to the appropriate person and program. A few other changes and things we have going on. We do still have some funding and support available for emergency assistance. So rental assistance, utilities, other emergencies. We've been seeing an increase in some of the other emergencies. So car repairs, different oddities as we start heading into the wintertime months, and people getting hit with a few different things with the seasons changing and transitioning. So those funds are still available. There is an application process for individuals and families. We are asking if folks need to meet in person or ask questions that they schedule appointments ahead of time, or we're trying to do those kind of intake processes virtually or on the phone. So again, calling first is always the best option instead of showing up at the office on Maple Ave. We are also doing a few different new programs at the agency that I wanted to make sure everybody was aware of. One of our newer programs is Recovery Employment Partnership Program, and that builds off of an existing program that we already had, our Recovery Friendly Workplace Initiative. And our new program, the REP, Recovery Employment Partnership, works directly with individuals who are in recovery to help eliminate barriers for finding employment. So it's a workforce development type program, but it's aimed at helping to support those in recovery while also working with the businesses who are part of our Recovery Friendly Workplace Initiative. So we're tackling kind of both sides of that employment issue and hoping to get things to meet in the middle to increase longevity with folks in the workforce, maintain employment, reduce turnover for the employer, which leaves them saving funding with having to retrain staff. We're really hoping that it helps make an impact on the workforce development needs that we have, especially for those in the recovery world. We have 2 youth transitional support programs happening right now. One is going to continue on, and it is a smart housing option for youth transitioning who are age 18 to 24. So those kind of leaving the childhood ages and starting to become adults. A lot of referrals for that program are coming through the Westmoreland County Children's Bureau, but really there's we can also serve some homeless youth through that program as well. And then we have a short time limited youth transitional support program. We saw some needs popping up as we've been going with COVID, that some youth, again, kind of in that 17 to 21 to 22 age range, are starting to struggle with school going on and off, transitioning from high school to college or high school to a vocational school, and things starting to slip because a lot of kiddos were off from March till August and very hard then to get back in the groove in September, and things are still not moving at a normal life expectancy kind of pace that would have been happening before. So we're providing some case management type supports and connecting those youth to services that are already available out there, but they may just not be aware of. These might be youth that have never had to access services before, families that maybe never have needed services before, and really trying to be a preventative support for these youth and the families and help the kiddos move forward, the young adults move forward into whatever area they're looking for. There's a ton of resources out there in our community, and so connecting those youth to what's already available. We also are maintaining, excuse me, our human services call every month. So we meet with, we have an invitee list of close to 100 individuals on the human services call, generally range anywhere from 25 to 50 individuals on the call. I did note that the next call should be hitting on Thanksgiving, so we will have to send out a calendar invite for a different day, and we'll have the same problem in Christmas. But knowing that we're going through winter and with the cold weather shelter and other pieces popping up, something that we're going to need to maintain. So we'll be finding alternate dates for those. And I had to make a list. There was so much happening since I was on the call last time. We are also doing our holiday giving program again this year. So those of you that have been familiar, this is something we have done again for years at the agency. Last year, we started collaborating with the Westmoreland County Children's Bureau to have their efforts and our efforts combined. And this year, we'll be having their full list of kiddos for doing holiday shopping. They are also providing us with their sponsors and support so that we can all work together in this effort so that more kiddos are served throughout this holiday time frame with holiday giving and gifts. We are finding that some of the sponsors who have been our regulars or Children's Bureau regulars are not maintaining it this year, partially because of COVID. a few churches and a few businesses are not doing the activity because as individuals would come to church or the office, they'd pull the angel off the tree. Well, with COVID, a lot of folks are not going to church at the same frequency. Some businesses are not having their employees come in. So we are struggling a little bit with seeing some of those sponsors with taking the kiddos a little low. Families can still sign up through next week. So I believe the 19th is our official cutoff day for referrals for that. Again, they can call the office, 724-834-1260. We'll get them connected with the paperwork that they would need to complete for that. Because of the anticipating the increased need with the collaboration with Children's Bureau and with COVID, we're going to be utilizing an off-site location for the drop-offs and pickups. One, we cannot maintain gifts for 1,000 to 2,000 kiddos in our office. It's a big office space, but not quite that big. And because of COVID, we wanted to be able to allow for a safe drop-off and pick up for families. So there will be an off-site location that as folks are looking to deliver or pick up toys, we'll work with them on coordinating pickup times. It's not our office, so we don't want people to just show up at that space if one of us is not there to assist. And maybe the last piece, if anybody hasn't seen our social enterprise out in Mount Pleasant, we have American Architectural Salvage, which is a demo company and restore store where we sell items to repurpose building materials. The demolition company has started an additional activity where we do the sanitization for COVID. So if anybody has a business or home need where you need the sanitization spray process, but you don't want to purchase the equipment yourself, that's something that our demolition team has been doing. We've hit several businesses and within the last few weeks. Unfortunately for the community that's happening, but it also goes to support our social enterprise and our demolition team, which is made up of folks who are have been faced with employment barriers themselves, and we're giving them a whole lot of additional training and experience during this COVID timeframe. So I think I've hit just about everything. So,
awesome. Thank
you,
you, Mandy. I appreciate that. Well, I think we have come to the end of our list of panelists, so I want to take a moment to thank everyone. Before we head out, Alyssa, I'll just check back with you one more time. Anything else that popped in your head from the United Way's perspective?
No, but that was a lot of great information shared, so I do appreciate everyone on the call.
Absolutely. Yeah, before we head out, just a reminder, once again, can't stress enough that those numbers are going up. We need to mask up, social distance, and continue to partner with each other so that we can get through this whole once we've come to the other side. Thanks, everyone. And once again, if there's anything that we can do to help, feel free to call. And I know that we're all willing to work together. Thanks so much.
Thank you.